Welcome, Justin and Kate.
Hi, Greg.
Hi, thank you for having us.
So, Justin, let's start with you. When we hear words like magic mushrooms and hallucinogenics, many of us think of hippies, LSD trips, and American psychologist Timothy Leary's tuning in and dropping out from the 1960s. But psychedelic drugs have been enjoying a bit of a renaissance in recent years, and in the best possible way in mainstream medicine, haven't they?
Yeah, absolutely. There's a massive amount of interest in it at the moment. But, I think it can be easy to forget that there's centuries of a very rich practice of using these medicines in Indigenous communities all over the world. And, these plant medicines were used in sacred ritual, for binding community together, speaking with ancestors, finding lost bits of cultural kind of information, healing, and in a really ritualized way as well. We are absolute latecomers to this, particularly us in medicine, trying to use it to sort of treat trying to figure out its place in the treatment of distress, psychiatric illness, psychological disturbance, and so on. And yeah, there's been a massive explosion of late, particularly over the last 20 years, after sort of decades of neglect, after the medicines were essentially, through the Dangerous Drugs Act, prohibited for kind of all research. So yeah, I mean, that massive explosion, we're really trying to sort of catch up in all the time that's been lost over the last 50 years. But, there's literally hundreds of years of use before that, leading up to this point.
You've just completed the first clinical trial of psychedelic-assisted therapy to be approved in Australia, run by St Vincent's Hospital in Melbourne. Tell us a little about that.
So the trial that we set up, we've literally just finished late last year. We treated 35 people, and the people that we sort of aim to work with were people who've got distress, despair, anxiety, depressive symptoms, really in the context of knowing that they're going to die, having a terminal illness. And that's a very different knowing that you're going to die to the knowing you're going to die that we all just carry around in this very sort of intellectual way as a notion. When you know for sure it's happening to you, it brings about usually this massive set of psychological changes, some of which are really expanding and wonderful and give you this, much greater appreciation of who you are in the world and what you mean to other people. But also too with that, deep grief that you'll be the one who's no longer here, a disconnection from the people you love, worry about what your death is going to do to them, as well as all the stuff that, the medical system does to people in terms of, subjugating them, making them feel like they're not in control anymore, putting them in weird environments and pumping them full of stuff. And so our trial really looked at that experience of knowing for sure your number's up. And what we looked at was a psychotherapy treatment, which included within it a psychedelic dose day. And people got 2 doses. The first was what's called a double-blind dose, where they didn't know what they were getting. It was either going to be the psilocybin or a vitamin pill. And then 6 weeks later, everybody got the psilocybin. The first dose, the reason it's called a double-blind is that, that they don't know what they're getting and we don't know what they're getting either. It's completely random. And the aim of that was to help us sort of look at, what does this stuff actually do? Does it actually add anything to the therapy? What are the side effects of it? What's the sort of expectation of how it's going to change you, and can you see that coming through? So it was a very involved process. There was a lot of screening to make sure it was going to be medically safe. There was then an even bigger amount of screening to make sure that psychologically it was going to be safe, because it is absolutely not for everybody. It's actually really hard work. It's really grueling. And the people coming along to the trial needed to commit fully to a pretty exhausting week of work with us around both doses. So that was what was involved. And the reason we did it was that, there's not a huge amount that we've got in medicine that's really good for that kind of existential, spiritual despair that people feel around the end of life. You know, a lot of the medications we use tend to just sort of sedate and numb people, which is really not what you want, particularly when what they really want is to feel like connected and wanted and valued and thought about and in the moment. And there's a range of other things that we would use as well, like, you know, creative therapies, music therapy, involving pastoral care, these sorts of things, which can be helpful. But this seemed to have a lot of promise. The research that was done around it showed that, you know, potentially for this group, it could be quite transformational. So that's the reason we went with the psilocybin.
Kate, you interviewed 3 of Justin's patients who took part in this clinical trial. One was a mother, only 42 years old. Can you tell us a little about her?
Well, the first of the patients who I interviewed was a woman called Shannon Turner, who in 2018, well, basically in 2018, her life was looking really fantastic, and she was very mother to a young child, Emma, trying with her husband for a second baby, nice job, lovely life, very fit, former dive instructor. And one day when she was breastfeeding, she finds a lump on her breast, and that kind of sets off a whole chain of as it must. There was, first of all, she went through various treatments, but she'd started off with a stage 2B diagnosis, and by the end of those treatments, she discovered that she was now stage 4 terminal cancer. So that was, you know, she went basically from being a very positive, kind of direct, seizing life type of person. This is, I mean, I get all of this from having met her and interviewed her in Cairns where she lives, but you can still feel it. But she basically sort of had, from our conversation, enormous anxiety, particularly about leaving Emma, and, you know, leaving this little girl who was 14 months when she was first diagnosed, and, you know, and 2.5 years when Shannon was given, essentially, was told that she only had a year to live herself. So, and essentially, she wanted to use all of the time she could to help her daughter, to be completely present, to be able to love her and fill her up with all of the things that you want a child filled with. But instead she was, well, maybe as well, but she was having panic attacks. She was going to hospital thinking that she was having heart attacks. Her sense of joy disappeared. And someone told her about this weird trial in Melbourne. And I believe that she called and spoke to Margaret Ross, who Justin is obviously your leader of this trial. Sorry. And she got on a plane and came down to Melbourne and took a hefty dose of psilocybin.
And how did she experience that? How did she describe it to you?
It's very interesting. I mean, different people have different types of experiences, but she had, in some ways, it was almost, as she was describing it, it's almost a textbook psychedelic experience, except of course there's no such thing. But her trip unfolded in a series of these very powerful visions. She called them visions. And for instance, in the first vision, which she said was quite frightening, she was in the presence of this creature, and it was sort of, she described it as a kind of like a sort of deformed fetus. And this creature was frightening to her, but also it was terrified, this little creature. It was, as she started to have this experience, she became so cold in the in the dose room. She told me that you and Marg had to go and get her blankets, and then somewhere in there she suddenly had this experience of she realised that the small creature was herself, and she called it Cancer Shannon. And with that realisation, she felt this other part of herself that was enormous reach down and pick up Cancer Shannon and bring her up and pull her into herself, and sort of have this experience of being filled with love and wholeness. I think that was a very, very powerful beginning to a long trip. But she also, just one other of the visions was of herself looking down and looking at her daughter, looking at Emma as a fetus inside her own womb, just about to be born. And as she saw that, she then realised that beyond Emma there was another womb containing another fetus, and that was her. That was Shannon. And then she could see this enormous long chain of all of these fetuses, these babies waiting to be born. And she said afterwards that because a lot of this, the process, you've got the trip, but the conversations before and after the trip, the therapeutic component is obviously incredibly important. And she said that it was during the sort of consolidation part of the conversation where she realised that every one of those mothers, beyond herself and her mother, that they were all dead, that they had all died. And I think she said she got this sense of her belonging to a natural order. And, everyone dies. Everyone's mother dies. And, you don't want it to happen. She doesn't want it to happen to herself, let alone at that age. But she could see that she was part of something much bigger. And I think that was enormously, enormously comforting.
So, Justin, can you describe how the psychedelic drugs were administered, how you supervised the patients when they're experiencing the drug, and what you did if they were a little bit uncomfortable?
So I guess the most important things about the psychedelic drugs are that they're given at the right time and they're given in the right way. And by that I mean that there's been a really deep process of exploration into the person's unconscious mental life and their inner universe. There's a sort of a shared understanding of their story and how they're experiencing their illness and why it's affecting them in this way at this time. And also too, some idea of what the psychedelic drug's likely to do. And getting to that point takes, a number of hours of talking, but that's the right moment to be giving it, when all of the feelings, when all of the stuff is right there. And so the drug itself, the psychedelic dose days, it's actually a super involved day. It starts early in the morning. There's a process of leading them into this the dose room, the dose space, which has been prepared with them already in the days before. There's a lot of kind of reflection in the morning about what may emerge and what it's going to mean. And then at the right point, it's just a pill. It's a small white pill, utterly unremarkable, looks exactly like something you might get, in any generic packet of medicine in a Woolworths. And then unfolding in the following hours is this hopefully extraordinarily intense experience, which basically collapses the divisions between past, present, future, yourself and other people, memories versus right now, the distinction between sounds and colours and your body and what's inside of you and what's out. All of that's kind of collapsed with these really intense feelings, and hopefully all this stuff you wanted to work on manifesting in that. And so the work that we do on that day, it's actually a very busy day for a psychotherapist, because not only are you needing to make sure that things are sort of tracking in the right direction, but often you'll be brought into the person's experience as well. Normally they would have on earphones and an eye shade and be listening to a playlist to really intensify that kind of internal focus. But often it gets a bit much and people need to come out. They need to have a conversation. They need to be grounded. They need to say something and to have it kind of heard and understood. And so there's a lot of, it's 8 hours of just non-stop work. And the stuff that, is challenging and difficult for people, that's actually the gold in this process. So, any psychotherapy process you have where you leave feeling good and happy and that was nice, almost invariably complete waste of time. It's the stuff in psychotherapy that's really tough and challenging and full of big emotions and confronting things. That's where change can take place. And so when people have difficult or challenging experiences and they work through it, we don't get in the way. We don't try and divert them from that. We want them to fully express all of that stuff because we know that's where the guts of it is. And so a lot of the work in sort of being present with them is finding a way to tune into what's going on, to keep them feeling sort of physically comfortable, like you spoke before about Shannon being really cold. So yeah, we were running backwards and forwards to the warming cupboard in the ward, and I think she ended up with like 8 blankets on top of her at one point, and gel packs and a heated throw. And then immediately when she got through it and the temperature changed, we had to rip all that stuff off. So there is, a bit of sort of physical attending to as well. And then, usually once they're through that peak experience and they're starting to kind of lift out, often they'll start to talk a bit more about what they've seen, what they've experienced, what they've learnt, what it's left them with, new questions, that then becomes the stuff of that consolidation process.
It sounds so much more. I mean, your background's as a therapist, and you work in palliative care. So obviously your work is intense anyway. But it sounds as if this particular process with this kind of amplification or whatever it is that happens with the drug, is something. Is it something else or just something more?
So I think there are, when you sit with people who are really trying to express to you what it's like to die, there's often this sort of indescribable, nameless sense of the world falling away from underneath their feet. And it's palpable, it's right there, and you can't look away from it. It can be quite overwhelming. And when you add a psychedelic drug to that, and it goes from being something experienced in a purely, cognitive or a purely symbolic way to something which actually feels like it's happening to them right there inside their mind. They are experiencing their own death. Yeah, there's a lot of very intense processes which emerge, very basic, fundamental, archaic human sort of experiences, which most of us hopefully integrated when we were 3 months old, and then we've kind of developed and become hopefully a relatively sophisticated sort of psychologically adapted adult. But the process of being confronted with your own death and the extreme vulnerability and the extreme sense of aloneness that can come with that, and the knowing but the being unable to put it into words in any way, shape or form, the full weight of that can hit you when you're there with people during their sort of psychedelic process. I mean, it's happening to them, but you're sort of brought into it by the fact that you've spent so long working with them beforehand and trying to sort of tune yourself into their psychological world. So yeah, it's a very, very intense process. It's a very it's also a very difficult process to kind of teach or explain, because it relies on you experiencing it as opposed to me putting bullet points on a slide and flicking through this and that and the other. But yeah, it's easily the most demanding work I think I've ever had to do.
Justin, many of these people have experienced recreational drugs in the past, or are they completely new to this kind of experience?
Also, like any sort of cross-section of society, some of our patients had these things before, sometimes years and years earlier, but in a setting where it was usually about, being with friends, being at a festival, having a great time, trying something new. And, like everybody that sort of tries these sorts of things, they would have experiences that were troubling and distressing for them, as well as some which they remember and hold on to as amazing. But, because we do it in such a different way, because it's done in the trial in a way where we set out to intensify the experience, and we set out to sort of intensify that kind of focus on what's taking place internally, and there's not the distraction of your friends around you. There's not the music in the background or wherever you were, 30 years ago. It's a completely different experience, completely different.
And can you explain the difference between psilocybin and, say, MDMA, commonly called ecstasy, in terms of the effects?
Yeah, so psilocybin is, what you call a classic psychedelic. It produces this pretty kind of predictable set of changes in the way that people's inner world feels, where you get this just total collapse of order. People can have visions. They can, converse with relatives who died 200 years ago. They can see their own birth. They can sort of trawl through their memory in a way where it's right there in front of them. And they can sort of also have encounters of, presences, creatures, all these sorts of things. And it's a very, there's a kind of strange like blending of experience too. So, you can have an experience not just of hearing music, but of actually feeling like you're made of it. You're composing it in the minute. It is flowing from you. It is something you breathe. So that's like a classic sort of psychedelic experience. MDMA or ecstasy, it's really not a classic psychedelic at all. It's more, it makes people feel a bit safer in their bodies. It can make people feel a lot more connected and a lot more open to connection. But it doesn't produce those really intense psychedelic experiences you get with psilocybin.
It wouldn't be as effective then, is what you're saying, for cases like...
Well, it's effective for different things. So, MDMA therapy, there's quite a lot of research saying that it's very effective for people with, post-traumatic stress disorder. There's, large body of work that's gone into sort of examining this, in the States, looking at veterans, at first responders, there's trials happening here. It's a totally different thing because they're people who don't have a sense of safety in their own body. They don't have a sense of safety in their own kind of mind. They're, in a sort of a disconnected state of being unable to leave that trauma behind, and it being there felt in every moment of what they do. Whereas the psilocybin, as it's used here, in our trial we're using it really for sort of anxiety, depression, despair in the context of dying. So it's a totally different kind of clinical population that we're looking at.
Kate, of the people you interviewed, did anyone suffer disturbing or unpleasant feelings?
For sure. Particularly the one of the three people I spoke to was a man, guy called Michael, and he's now mid-70s, and he'd basically, he's been a successful builder, nice life, lives in a Bayside Melbourne suburb, got a yacht, like he'd sort of built himself a pretty good life, and then out of the blue he goes and has a checkup and finds that he's basically got terminal prostate cancer, and he was completely thrown by the diagnosis, and really sort of described going into a state of almost sort of ricocheting between deep paralysing depression and overwhelming panic attacks. So it's from what he said to me, by the time he arrived with you guys, he was very, very distressed. His trip, or his first trip, which is the one we talked about most, he said at the outset, look, if I'd known what was going to happen, I don't know if I would have done it. He said he described it as terrible. At the same time, he doesn't remember visions. He doesn't remember a lot of what happened. He remembers feeling very, very anxious about physical stuff that was happening with him, and sort of a huge amount of distress around it. And I think it wasn't until, he described it being over and him going, oh, well, thank God that's done. I'm never going to do that again. And, spoiler alert, he did go on and do another one. What happened to him afterwards was so telling, was that he basically went home from this experience, got home and just, well, two things. He had become aware, and I'm still not quite sure whether this awareness was during the trip or this came out sort of as he was coming out of the trip, but he had been to a Catholic boarding school in Ballarat as a child with his younger brother. And what came up for him was an enormous amount of fear, not for himself, but that something terrible had happened to his younger brother at this school, which was one of the schools that was looked at in the Royal Commission into Institutional Abuse. So he hadn't spoken with his brother about this. And on the evening of that first trip, he rang his brother and he said he picked up the phone and cried for an hour. And, and he kept on saying, and I don't cry. I don't cry. Men don't cry. And then he said, but all I did for the next week, he said, basically he could watch a tissue ad and he'd be weeping. But with all of that, and he said I could feel it. I could feel that something was changing in me. It was as if my brain was being reworked. And what came out of that difficult and distressing, 6 to 8 hour trip was he just said, now I could apart from crying a lot, I'd wake up in the morning and I'd see the sun shining and I'd feel relief and pleasure and I'd be able to just get on with my day. So he didn't sort of have the kind of symbolic vision, sort of imagery that both Shannon and the other woman I spoke to, Simone, had. But whatever happened to him did make and has continued to make a huge change in his life. And he's a very, the three people I spoke to spoke because they wanted to talk about their experiences, and they wanted to talk about their experiences because they felt their experiences had been life-changing. And obviously there were another 32 people in that trial who had a whole great variety of different experiences, which we'll find out more about when the results are actually published, presumably this year sometime. But it was fascinating talking to the thing that struck me in the conversations with Shannon and with Simone, who I should add is another mother with a young child. She actually kind of weirdly had worked with Simone, so she knew her a little bit, and she heard about the study through Shannon. They weren't great mates at that point, but they both had young children, and Simone decided to go and do the trial because of that. And she had also had very intense visionary experiences, and she brought a lot of her own difficulties into that trial, including the fact that during her cancer treatment, her husband was having treatment for alcohol addiction. They separated 6 months after her diagnosis. She was terrified about what this would mean for their son Raphael, and and I think talking to each of the three, Shannon, Simone, and Michael, they each came with massive fears which were to do with dying, but partly, you know, sometimes the actual fear of death and disappearing, and which I think might have been, certainly I think for Shannon and Simone, the overwhelming fear beyond their own deaths was the fear of leaving their children behind. And what was so, you know, it was such a privilege for me to speak to each of them afterwards, because it was hearing people speaking with enormous clarity and a lack of fear about their impending deaths. And it sort of made me realise how uncommon, how unusual that is. And it was kind of, you know, it was a relief to me to hear them talk. It was very moving. It was very emotional. I mean, there were tears. But this sense of people actually being able to look at themselves in the world and go, okay, this is where I am, and I can still look out the window, I can look at the sun and be grateful. I think that was the other thing that came through, was this sense of gratitude for their lives. You know, and obviously I'm only speaking here about the three people's experiences, the people who I spoke to. I can't speak for anyone else, and I don't know what else happened with other people, but it was very powerful.
So, Justin, it sounds like the therapy has a pretty long tail, which is quite remarkable from what Kate's saying, that months and months later after treatment, this therapy has had a profound effect.
And look, I think, you know, in terms of how durable the improvement is after this kind of therapy, I think, you know, there's a couple of really important things, you know, you mentioned, Kate. One is that, you know, people can find a way to see their death as a totally natural part of their life, and they can find a way to embrace it and to be curious about the idea of it, and to go in it in a way also too where they sort of know, like really know, that there's more to them than just their body, that they'll sort of continue on in some way, that, you know, that there's a connection that remains. And absolutely, I think, you know, that's one of the things which, you know, people have spoken about that's been quite sort of astounding. I mean, in terms of other things, it's people that, you know, because it's psychotherapy, the more work you put in generally, the more you're likely to get out of it.
As a patient, you mean?
Yeah, absolutely. And so, you know, I think, you know, these kinds of treatments, people that sort of come along and think, you know, I've had lots of pills for my depression or, you know, other treatments. This is the next pill in the queue. Where's my pill? I do not believe that those people, you know, people that kind of view it and experience it in that way, or who it's presented to in that way, I do not believe that they're going to have durable kind of improvement from it at all. You know, I think the people that do best are those who, like, fully engage with the therapy process. They work on themselves. They're curious about themselves. They're sort of able to peek into the dark corners and be astonished by what they see. You know, they're able to kind of learn new things about themselves as they go, and they're not avoidant of their feelings. You know, I think anybody who's able to do those things is always going to do really well. You know, I mean, it's wonderful to hear about Simone and Shan and Michael, who, you know, we finished working with, you know, some time ago in terms of their experience in the trial. You know, so to hear you sort of talk and update, you know, how they're going and how it's sitting with them is really, it's great to hear. I'm really grateful that they've had an experience like that.
Clearly the trial has had a profound effect on so many lives, Justin. You must be feeling pretty satisfied now that it has played out so well. I believe that Australia, until your trial, was pretty much behind in the medical use of psychedelics. Is that the case?
I don't know if I'd say that we were behind. I mean, I think, you know, when we started our trial, there were literally like 10 to 12 worldwide So it wasn't as though it was a massive thing. It wasn't as though there was a huge explosion of kind of work in some other country, and we just sort of came along at the end of it. I think when Marg Ross, who really is the person who's behind all of this, she's really the person who did all the work for it. When she had the idea, and we then sort of approached St Vincent's Hospital, the executive, who were very open to it, very thoughtful about it. There wasn't just this kind of knee-jerk response of, you want to give people drugs. There was actually a considered, thoughtful response to it. That was the perfect place to do it, absolutely. But since then, there's been this massive explosion, particularly in Australia, with the rescheduling, the down-scheduling of the drugs, where they've gone from being only able to be used in a clinical trial to now being able to be used for clinical treatment, provided they're given by an authorised psychiatrist, and people meet certain criteria. So, we were all utterly astonished and blindsided by the rescheduling. There's still a lot of research that needs to be done, though, to figure out, who this works for, but also to which bits work. Like I was talking before about the psychotherapy itself, and there's the drug that's nested within that. In terms of figuring out, well, what's essential, what's actually what are the cogs within this that make this thing run? Well, we don't know that yet. We're still trying to figure it out.
Well, look, it's a profound undertaking, this trial, and many would congratulate you on your work. It sounds like it's made a real difference in many people's lives, facing the biggest, perhaps most confronting issue in their lives. So thank you so much for both sharing those stories today.
Thank you very much. Thank you for having us.
Thanks, Greg.